Hello everyone. I am Dr. Munir Musa, Volunteer Director of Global Forum for Teacher Educators. Welcome to the third series of webinars, Skills Accelerators. One of the motives of Global Forum for Teacher Educators is to arrange awareness sessions on pertinent human rights issues for global communities. We want to empower you to create positive ripples of awareness among wider communities. September is a month of childhood cancer awareness. I have been volunteering for children battling cancer for the last 17 years, and I can't express how painful it is to see them in pain. Remember, cancer cannot only affect the child, but also the mental health of the family members. Cancer can affect any child at any age. A good number of children lose their life every year due to delayed diagnosis. Lack of awareness about childhood cancer is one of the gaps we will try to bridge. And today we have one of the renowned Dr. Sadaf. Dr. Sadaf, welcome. Hello, Dr. Sadaf, can you hear me?
Yes, thank you so much for the invitation and for allowing me to talk about something that I'm so passionate about. And I really am so grateful to you that you're doing such a wonderful job of creating awareness. Because when you had approached me, I really wasn't familiar with your organization and what you were doing. But honestly, I'm really humbled and I'm really impressed by this session and its global reach. There are individuals from all over the world, and I'm really excited to be here. Thank you.
Thank you so much. So let me read the profile of Dr. Sadaf. Dr. Sadaf Altaf is a graduate of Dow Medical College. She trained as a pediatrician at Mayo Clinic in the United States of America. She further pursued training as a pediatric hematologist oncologist at Mayo Clinic Hospital, and also completed her master's in clinical research. After completion of training, she joined the Aga Khan University Hospital in Karachi. She has been actively involved in educating and training medical students and junior doctors. She is also a program director of Pediatric Hematology Oncology Fellowship at the Aga Khan University. Her area of interest are bone and soft tissue tumors in children, hematological disorders, and bone marrow transplant in children. She's also a co-chair of SIOP, that's International Pediatric Oncology Society, and she's working for the Supportive Care Working Group. Her goal is to educate healthcare providers in improving the lives of children with cancer in developing countries. So, Dr. Sadaf, once again, formally, I welcome you on the behalf of Global Forum for Teacher Educators. Many participants have asked the questions during the last 1 week. So, I will be throwing the questions one by one, and then you can give the answers. So, if you accept me, so I'll start. Shall
yes,
I?
Please. Yes, please.
Thank you so much. So there was a first question, the very important and basic question by one of the participants. What is childhood cancer?
So imagine this, that there are cells in all of the human body, and every day those cells are growing or having some changes. Okay. Cancer happens when any cell inside the human body has uncontrolled growth, because nature has created mechanisms for putting brakes on abnormal growth. But when those mechanisms fail, then those cells just start growing and eventually they turn into cancer. So very simply, what it is, an abnormal growth of any cell of the body.
So the next question is, what are the most common types of cancers among children?
Okay. So, cancers in children happen, first of all, because the first question that I'm asked by individuals is, do kids or do children get cancer? Yes, they do. And their cancers are very different from adult cancer. So, the three or four most common cancers that children get are: number one is blood cancer, which is leukemia. Number two is brain tumor or brain cancer. And then number three is a cancer called lymphoma, which happens also within the blood or lymphatic system. And then bone and muscle cancer. So these are the four really, really common cancers in children, which are very different from adult cancers because adults don't commonly get these cancers.
So are these common types of cancer more common in the developing countries or everywhere?
So, if you look biologically, I think the cancers are the same, whether we're looking in Europe, United States, or Asia. But the number of children are much more in our part of the world. So, you can say that, the burden of cancer is also pretty significant in our part of the world. But generally, the biology is very similar all over the world.
So the next question is, can children inherit cancer from their parents?
So again, whenever a child is diagnosed with cancer, I think that is the first question that parents ask. Their first question is, "Did I give this cancer to my child? Was I the reason that this child inherit this cancer?" So the answer to that is no. The overall number of cancers that are inherited is very, very low. Less than 10% of all cancers are inherited. So there are certain families where there is a higher risk of getting cancer because there is a predisposition in that particular family. But in general, children don't inherit most of their cancers.
So another question asked by one of the participants is, uh, what are the main causes of childhood cancer? When I'm also volunteering and I'm uh, looking at the people, they're asking the same question. What are the main causes?
Okay. So imagine this, that, when an adult gets lung cancer, we attribute it to smoking. A lot of lung cancer can be due to smoking. So in children, there is no such cancer that is directly linked to a particular cause, or it is directly linked to something that they have received or eaten or been exposed to, except one thing, and that is ionizing or nuclear radiation. For example, I give this example to explain it to everyone, that when the atomic bomb happened in Hiroshima, Nagasaki, there were so many children that developed leukemia because that is the one classified cause for causing cancer in children, even in adults. Other than that, people tell me, oh, should we feed our children this because we think this causes cancer, or should we not give them this, and should we keep them away from this radiation from the cell phone, radiation from the screen, those things. Again, there's conjecture there, but this has never been scientifically proven. This has never been scientifically studied. So again, except for ionizing radiation, there is no single causative agent for cancers in children.
I was reading somewhere, I'm not sure whether it's true or not. I read, but I think it's a myth that if a child falls, if a child drinks phenyl and any other thing, any liquid, any chemical during the childhood, they can get the cancer. Is it true? Is there any reliability of this news?
This is a very good point that you bring up, Dr. Munir, that when a child falls and then, parents find out that their child has cancer. So imagine in their lifetime, children fall a lot. Okay. children get injuries a lot. So the way I explain it to the parents is this, that the cancer was brought to attention because the child fell and had that injury, and they noticed that particular area. So that is the one thing, that I tell them, and they say, so falling per se will not cause cancer. Okay. And the other thing about ingesting phenyl or any chemical is, if a child has ingested a toxin, so that particular tissue has been damaged, and there is a risk of developing cancer in that particular area. So.
So, how can we identify? There's a question by someone. How can we identify if my child has a cancer? And what are the
Uh,
main common symptoms of childhood cancer?
Right. So, what happens is, in general, children play, they are sort of active, they're sort of, doing their activity all the time. So, anytime a parent notices that, the child is not being themselves, like their activity is significantly down, plus persistent fevers that have been going on for a very long time, those are red flags for development of cancer. So, as I said, leukemia or blood cancer is one of the most common cancers in children, and fever is one of the most common presenting symptom, or the way that children present. The other thing is weight loss, which is also sudden. Fever, weight loss, these two things, they should alert the parent that something's not right. And then, if the parent is noticing any abnormal swelling in any part of the body, for example, in their arms, legs, in their belly, if their belly is swollen, then get it checked, because it can be a cancer.
Okay. So the next question is, can childhood cancer be detected early?
Well, see, that is the major difference between the Western world or the developed world versus us, that we always have delayed diagnosis of cancer. So, childhood cancer can be detected early because children are regularly examined by their pediatricians. Okay, they go to them, they measure their height, they measure their weight, they look at their health in general, they examine them. So, that is why those cancers are detected very early. A physician is checking a child at least once a year, or at least every 6 months, or, 4 months or so. So, yes, childhood cancer can be detected early by regular physical exams, especially when children are going for their vaccine and their doctor is checking them out. And he's like, oh, this swelling, how long has the swelling been there? Has it been growing? Is it hurting them? So yes, childhood cancer can be detected early if children have regular physical exams. Our challenges in the developing world, we don't have that sort of infrastructure where children are regularly seen by a physician and examined regularly. But if that infrastructure is in place, then yes, cancer can be detected early.
There are two questions parallel, I think, so it's very similar. What are the chances of curing childhood cancer, or are there any recovery chances in childhood cancer?
Okay. So, yes, I mean, I would really like to stress on the point that childhood cancer is very different from adult cancers. Children get cured much better than adults when they have cancers. But granted that it gets detected in time and it's not spread to the whole body, or if it is not an advanced stage cancer. Childhood cancer, for example, take leukemia, for example. The cure rate for leukemia, particularly one kind of leukemia in the West, is 90%. So 90% of children that get leukemia get cured. It is not the same in the developed world. We are much behind because of various reasons, but we are still doing a pretty good job where we are curing 70 to 75% of children with leukemia. Similarly, there are certain tumors, for example, a tumor of the kidney, which is called Wilms tumor. 90% of children are cured from that cancer. So children can get cured from cancer much better compared to adults.
So the next question is, How to diagnose and avoid cancer during childhood? There is a similar question. What are the treatment options available for different stages of childhood cancer?
So the thing is that, as I said earlier, you can only avoid something when we know what's going to cause it. But in general, keeping a healthy lifestyle is very important. I do feel that, in this day and age, we are exposed to so many chemicals. We are not we're taking a lot of processed food. We're not really paying attention to healthy eating habits and diet. So in general, keeping a healthy diet and keeping exercise as part of the routine just keeps everyone healthy. So healthy lifestyle is important, but detecting cancer early, that is only possible if children are sort of examined regularly by their physicians. Now, as far as treatment is concerned, now treatment will vary on what sort of a cancer it is. For example, leukemia therapy. Now, ALL, which is the most common leukemia, or acute lymphoblastic leukemia, that therapy is 3 years long. Okay, but during those 3 years, children are able to go to school and continue their therapy. So we send them to school while they're getting their therapy. So imagine that they're able to maintain their lifestyle while they're still on therapy. So it depends on the stage of the cancer, and it depends on the type of the cancer. I think, Munir, you're muted. Can you unmute yourself?
Can you hear me now?
Yes, I can. Thank you.
Okay, there is one question which is coming in my mind. Is it also related to the immune system? Because I have heard from the people that if the immune system is strong, so children can resist cancer and all that. So, is there any link between cancer and the strong immune system?
That's a very good question. So, yes, there is a link between having extremely weak immune system, certain disorders, and then having cancers. So, yes, if you have a very, very weak immune system, chances of getting cancers in certain immune deficiency disorders are high. So, there is a correlation, or there is an association between immune system and development of cancer.
Okay, so how to avoid cancer during childhood? Is there any suggestion which you would like to give to the audience? Because the question has been raised by someone, then how to diagnose and avoid cancer during childhood?
As I said, keeping a healthy lifestyle and hoping for the best. I mean, a parent should never have to raise their child with the fear that their child may get cancer. Okay, when it strikes, obviously we deal with those parents and those children. Nobody is thinking about it. So I would never want parents to consciously think about their children might get cancer. I would never want them to do that, but I would want them to be vigilant when their child is ill. An illness that is not going away, an illness that lasts 1 or 2 days. Most kids get that, but an illness that is not going away, it's been a week, 10 days, their fever is not going away, then I think you should think about taking them to a specialist and having them checked out.
One of the participants has asked a question about what are the possible side effects of chemo. But before that, Dr. Sadaf, if you can tell the audience generally about what chemo is, and then later on, if you can tell about the
Okay.
possible side
Sure.
effects.
Yes. So, chemotherapy is the name of medication that is used to kill cancer. Okay. Now, imagine that cancer is a very, very strong sort of, you know, it's killing all your body cells. So, cancer is extremely, extremely strong. In order to kill something that strong, you need something very strong as well. So, chemotherapy is medication that specifically targets cancer cells, but it does affect normal cells as well. Which is why, when chemotherapy is started, it causes children or even adults to lose their hair. It causes mouth ulcers. It causes, deficiency in their immune system because, it is killing the cancer cells, but it is also affecting the normal body cells. And that's where your specialist job is, to how to manage those side effects, how to manage those complications. So it can affect any organ of the body, such as your heart, lung, kidney, liver, all of those can be affected by chemotherapy. And that is why the specialist really sort of, looks and checks out every organ and then makes sure that, yes, we are okay to proceed with this dose of chemotherapy because we think this is not going to harm the body this much. But if we give this dose of chemotherapy, that can be really harmful. So it's really a balancing game, a balancing act where you have to give enough chemo to kill the cancer cells, but maintain the normal cells of the body and prevent them from damage.
Okay. Uh, will it affect my child's normal development? So, is there any relation between cancer? If a child is battling cancer, will it affect the normal developmental growth of the child?
Yes. So the way I would look at it is, again, it depends on the type of cancer. For example, if it is just the cancer of the kidney, okay, you give certain chemotherapy and you do surgery, and then the child is fine. Their growth will not be as affected. But let's say this child has a brain tumor. In children with brain tumor, when the brain is affected with cancer, their growth can be significantly affected. Similarly, if a child has leukemia, and we see this all the time, even though they get 3 years worth of chemotherapy, they grow very well. Majority of children will continue to grow very well. Actually, I have patients who are going to medical school. They're becoming physicians themselves and they had leukemia or a certain type of cancer. So yes, there are certain cancers that can affect growth. There are certain medications that can affect their development and growth, particularly children with brain tumors. Their development and growth is really, really remarkably affected.
Okay. Do cancer recur after the treatment? Is there any possibilities?
Yes, it does, and the possibility is this: any cancer. There's never a guarantee of 100%. Okay, with every cancer, there is a 10 to 20% chance that it can come back. So we can never say that we have cured a patient with cancer and the cancer will never come back. We can never say that. So 10 to 20% chance of recurrence is there with any cancer and all cancers.
Okay. So there's a very interesting question by someone from Pakistan. Is cancer caused by fizzy drinks and food with colors and preservatives?
As I said earlier, nobody has been able to prove this in a scientific study. But fizzy drinks, preservatives, they have tons of side effects in general. For example, fizzy drinks can cause porous bones because they leach out the calcium and phosphorus from the bones. So if children are consuming fizzy drinks on a regular basis, their bones are really, really weak. Okay. And I feel that preservatives and additive colors, they are responsible for causing a lot of allergies in the body. So these are things that have been studied, but their direct association with cancer has never been found or studied. Similarly, a lot of people say that cancer eats sugar. So if you eat a lot of sugar, then you may get cancer. So again, there is no science to prove it, but in general, eating a lot of sugar is not good for anyone. So no direct association has been scientifically been found.
Okay, I have one question, personal question. As I'm volunteering at different hospitals for children battling cancer, whenever we send things to them, the doctors and the medical staff always tell us, please don't give chocolate to the children. We will not allow that. Is there any reason behind that? Why they are not allowing chocolate and all these things?
Um, I never stop it. So I don't know. Different hospitals may have different policies. So the things that we don't allow, I'll tell you what we don't allow. Um, if let's say there's one thing, for example, honey. Honey has this particular toxin called botulism toxin. So that in immunocompromised or children who do not have any immunity because they're on chemotherapy, that can be lethal. Similarly, dairy products, because the chances of them going bad in the summertime is very very high. So we never allow cheese and dairy products, especially if it's very organic. So sadly, even though organic things are supposed to be good for everyone else, but organic products such as even probiotics and all, we can never give them to immunocompromised or children with cancer. There was this also a practice where we used to say that don't give them fruits that you cannot peel. For example, strawberry or grapes or dates. Because there can be germs on their skin. For example, on the skin of strawberry or grapes, versus a banana, which can be peeled, and that's fine. So from that standpoint, I think chocolates, I never stop. I mean, most of us are pretty comfortable with chocolates, but we're very careful with dairy products, creams, and yogurt and all. So we have to make sure that in the refrigeration is decent and they haven't gone bad.
Okay, so there's a question: can my child live a normal life after treatment? I think so. All the parents always desire to have a well-being of their children, and that is why somebody has asked this question: is it possible for the children to return back to the normal life?
As I told you, majority of our children with leukemia, they start school while they're on therapy. So, as I said, depending on the stage of the cancer and the type of the cancer, while they're in the hospital, they're running around, they're playing, they're doing coloring and enjoying life like a child. So that's why I chose pediatric oncology, because I found adult oncology to be so depressing. And children, even when they're slightly better, they'll go back to their activity. So yes, there is absolutely a chance of your child living a very good, healthy life, depending on the type of cancer they have and depending on the stage of cancer that they are diagnosed with.
Okay, I'm not sure about the developed countries because we have participants from 47 plus countries, but there is a myth in the developing countries at many places that you should not drink the water from the same glass which has been used by the child battling with cancer, or you should not play with them. Is there any reality with these myths?
There isn't. Actually, the child with cancer is at risk from others because their immune system is weak. So, if you have a cold or if I have a cold, I should not be sharing my glass with them because I can make them sick. They cannot make others sick. They cannot give their cancer to anybody else. So, you have to protect them. Stay away from them if you have a cold, if you have diarrhea, if you have a fever. So, please, they will not make you sick, they will not give you their cancer, but you can make them sick. So that totally is a myth, that they can give their cancer to anybody else by sharing utensils or by sharing their things or playing with other children with cancer. So they're the vulnerable ones,
Yeah.
not the other children.
So I think so you have answered the next question, that can a child battling with cancer pose a health risk to other children? No, they don't. Rather than that, the other children might expose them to problems, right?
Yes, absolutely.
Okay,
Absolutely.
so what are the very important question, because I think so when I'm volunteering, I'm also looking at the same scenario, that mental health challenges are being faced by not only by the siblings but also by the parents and also by the child. So the question is, what are the mental health challenges faced by parents of the children battling cancer, and have you ever encountered any such event in your life, in your experiences?
This is a very, very sad reality of children who are battling cancer and their families. It's actually the whole family that is completely sort of affected by it. And particularly, the mothers. their mental health is really, really devastated. um, and again, in the developing world, there's a lot of support system for these families. There is a social worker, there are psychologists, there are people to talk to. But in the developing world, and in the low middle income setting, we don't have any infrastructure, we don't have any support system, and the parents are suffering. They're traumatized, and mentally they have nightmares. They keep thinking about their child. Their siblings are suffering because the whole family dynamics is affected. So yes, mental health is a big challenge in families who have a child with cancer.
So another last question is here, and then we look at the live chat box. Uh, if you can give some few tips to the parents how to strengthen their own selves while knowing that they are going to lose their child. I don't think so. They should think negative about it, but still, there is a question by someone that if they have a fear of losing the child, how they can empower their own selves to strengthen their own self to deal with this issue.
Yeah.
Any suggestion?
Oh boy, that's a really tough one
True.
because it may happen to some, and I don't think anybody can prepare themselves for this calamity. Anybody can handle it very well. Nobody can. But what happens is, knowing that one tried, knowing that one tried their best to get whatever therapy their child needed, that can just give them some strength in dealing with this, outcome, which I hope no parent has to face. But I see everyday parents who deal with this challenge, and giving themselves time to grieve, giving themselves time to come to terms with this. But this may happen, and trust me, nobody can ever be prepared for this.
No doubt. No doubt. Okay, these were the question. Is there any? Yeah, there's a question here, but before that, Dr. Sadaf, I would like to ask you if I have missed anything, if you want to elaborate, so please, more than welcome, and then we'll take few of the questions from the chat box.
Yeah. So the one thing that I would like to mention is, please remember that childhood cancer is very different from adult cancer. I, being a pediatric oncologist, cannot treat an adult with cancer. Similarly, an adult doctor cannot treat a child with a childhood cancer. So it may not be a big problem in the developed world, but it is certainly a problem in the developing world where parents seek help in the wrong place. So if a child has been diagnosed with cancer or is suspected of having a cancer, make sure that a pediatric oncologist or a children's cancer doctor sees them, and understand that you need specialized care, and a small facility or a small hospital may not have the capacity to treat a child with cancer. So get them help at the right place at the right time. Don't delay seeking help early.
There's a question, if you can look at the screen. Question, so we can't give strawberries or other kind of berries. It's written on the screen.
Okay,
Yeah,
yes. So I can elaborate further on this.
sure.
So I will mention again that the reason why fruits without a peel are slightly caution is sort of recommended, because the germs may not be washed completely from the skin. For example, if you're giving your child mango or if you're giving your child banana, you can take off the peel. So any germs on the skin are completely sort of taken off. If you feel you have washed it very, very well, then you can give your child strawberry or berry of any kind. And this is for children who are getting chemotherapy. This is not for an average child. So, if your child is getting chemotherapy and if you're giving them fruits like berries, you have to make sure that those are washed extremely well.
Okay, is it good to eat frozen food and all the canned food? What are your views about those things?
Yeah. I'm not a big fan because again, those have preservatives. It's best to use fresh ingredients, fresh cooked food. Particularly if a child is getting chemotherapy, then I would definitely not recommend frozen foods because you don't know the frozen food chain broke at any point. The food thawed and then froze again. So that is certainly a big no-no for children with cancer,
Okay, there's a
blood
question on
cancer.
the screen.
Okay. Children's blood cancer is generally treated with chemotherapy, and majority of children will get cured with chemotherapy. And as I mentioned earlier, the symptoms of blood cancer would be fever, weight loss, and maybe the child complains of a lot of bone pain, pain that will make them not want to play, not want to walk, not want to do their daily activities. Those are alarming signs for leukemia.
Okay, another question is on the screen.
So the question is, can we identify whether child is suffering from cancer at home or not? I think it's going to be very difficult because first of all, no parent wants to think that their child may have cancer. So I think you need specialized tests and you need a very good exam to even suspect cancer. So no, I don't think that you can do it at home. There's another question that says, is it curable in second stage? So again, it depends what kind of cancer it is. Whether it is the cancer of the kidney, or it is the cancer of the liver, or is it the cancer of the brain? So it's a very general question. So second stage may be very good for a particular cancer, but it may not be very good for a different cancer.
Okay. If there is any other question, dear participants, we have last 2 minutes. You can ask the question, you can drop the question in the comment section. Dr. Sadaf, in the meantime, I have one question. Since you are working with children battling cancer for the last many years, is there any joyful incident which you would like to share? Any
No.
joyful incident which you recall?
Many. I have many joyful incidents, particularly, so what happens is they lose their hair when they're going through chemotherapy, all right? And then once they're done with their chemotherapy, they come back and see us. And when I walk into the clinic room and beautiful long hair, especially, the teenage girls or the little ones with curls and all, I think that is just so heartening for me. That is just a little thing that, I walk in the room and this child with like a lot of hair and, it's like, moving around. So every single day I derive joy from that. Or when they make a drawing for me, even though they're so sick and they still want to color it and then write my name on it and give it to me. I mean, that just makes my day.
Wonderful. There is another question on the screen.
Yes. So the question is there any difference between medicine used in chemotherapy for children and adults? Definitely there are differences because the cancers are different, plus the doses that we use will be very different for children versus adults. I think there is another question that says, can a
Yeah.
child have blood cancer, continue his studies like a common child, or he or she should need a separate curriculum? Okay, with blood cancer, I think what happens is that only for the first 6 months their education is interrupted, but after 6 months, then they can continue their education. So all my children, basically, they do lose out on a year worth of their education. So, for example, if they were in sixth grade, then they would go back to sixth grade and repeat that particular grade, but then they catch up. But they don't need a special curriculum. Um, there is one question which says, which type of cancer is the most dangerous to a child? Is it blood cancer? So, blood cancer is not the most dangerous type. Actually, I would say it is the stage of the cancer in which the child is diagnosed. So, if it is completely, spread, then that is really, really dangerous to the child.
Okay, another question on the screen.
Yes. Can children have faster recovery rate than adults too? Yes,
You already discussed.
absolutely. Absolutely. Much, much better than adults. Absolutely. Is chemotherapy the only medication that can kill cancer? The answer is yes. Chemotherapy is the only medication that can kill cancer. So the question is, I just happened to know a friend that his son died while having chemotherapy, and it saddened him to think that chemotherapy was the reason why his son died early. Would there be a possibility that a child with cancer, if not treated with chemo, would have had a longer lifespan? I think, again, cancer cells are just so strong that you need strong medication to kill them. And yes, and that is why chemotherapy has side effects, and it is the job of the physician to manage those side effects, but sometimes those side effects can be uncontrollable as well. So I'm really sorry to hear that your friend's son passed away with side effects. um, there's a question about a vaccine for cancer, and there are certain cancers, very, very rare, that there is a vaccine for, but in general, there is no vaccine for cancer.
Okay, there are two or three questions. I think so. Participants are taking interest, and if you don't mind, shall I take three or four more questions? If you don't
Yes,
mind.
absolutely. Absolutely.
Thank you so much. Thank you. There is another question on the screen.
Yes. So the question is, what's the difference between chemotherapy and radiotherapy? So chemotherapy is the chemical that we put in the body to kill cancer cells. Radiotherapy is a form of radiation. I talked about ionizing radiation causing cancer earlier, remember? But this is a good form of radiation that is used to kill cancer cells. So you can't see it because it is being given through a machine. Chemotherapy is given like a drug. So a drug is given into a vein or orally, whereas radiation therapy is given through a machine to the area of cancer. There's a question that says, would you suggest any herbal medicine to cancer patients or always allopathic? Um, you know, uh, Actually, we tell them to stay away from any sort of supplements because they can interfere with their chemotherapy. So the answer to that would be no. There is a question which says, will chemotherapy assure 100% of treating cancer illness? And the answer is no, because there are no guarantees when we are dealing with cancer. We can never say anything actually with any illness that we will cure this illness 100%. So we have numbers, for example, I said that 70 to 75% children with leukemia will get cured. Similarly, if it's the tumor of the kidney, 80% of children will get cured. But there is no cancer where we can say that it is 100% curable, at least in the
Okay.
developing world.
Okay, I know you are not running the pharmaceutical company, but there is a question by someone, if you can answer.
Why medicines of cancers are so expensive? Not all medicines of cancer are expensive. Interestingly, the medicines that we use for children with cancer, they were first discovered in the 1960s and 70s. So they were actually even lost their patents. So the chemotherapy for children is not as expensive as adults, because with adult cancers there is newer therapy coming on every few months or few years. Those are extremely expensive medications. So in general, chemotherapy in children is not outrageously expensive. Prayer is the most effective remedy in curing different types of cancers. Do you agree? I absolutely agree in the power of prayer. I absolutely agree in the power of having faith. But we cannot just rely on prayer to cure any illness. As a scientist, as a physician, I cannot make that statement. So, prayer and faith, along with appropriate therapy, will cure cancer.
True, we cannot only rely on prayer. There are so many people who believe that prayer will cure everything, but we have to use logic. If there is a disease, we have to go to the doctor. We have to go through the treatment phases, because otherwise, if we are only relying on one thing, I'm sure that's not the solution. There's a question on the screen.
That won't be a good outcome. What tips can you give, madam, to avoid cancer at early age? I tell, the first question that parents ask when their kid gets diagnosed with cancer is, why me? And the answer to that is, honestly, nobody knows. And it's pure bad luck. So, knowingly, it's very hard to avoid cancer, but having a healthy lifestyle, avoiding, processed food in general is a good idea. Avoiding sort of, sedentary lifestyle in general is a good idea. So activity, healthy foods, they're good for general health. Is important. Well, there's a question which says, is important age of child to vaccine for cancer?
What is the
There is.
particular age to? What is the particular age to vaccine a child with
Yeah.
cancer? I think
There aren't any vaccines particularly or for cancers that have been discovered yet. So I wouldn't be able to recommend a vaccine for cancer at this point. Maybe in the next 10 years we may have vaccines for certain
yeah.
cancers.
So there are two last questions. I think so we've already answered how can we avoid cancer. If you can give a few more tips to the participants.
My tips would be that just don't ignore your child's illness. If the child is having fevers, weight loss, severe bone pain, then have it checked out. If there is a swelling in some part of the body that is growing rapidly or causing pain to the child, get it checked out. If you're noticing something unusual in the behavior of the child, like they're not actively sort of playing, or they're not able to be themselves, then get it checked out early. And I think the earlier it is brought to attention, the better the outcome will be.
Okay, the last question is on the screen now.
How much is the survival ratio in your experience? So, if you talk about our experience in the developed world, we have numbers for cancers. For example, leukemia, we're able to cure 70 to 75% of children. If it is a kidney tumor, we're able to cure 80 to 85% of children. If it is a bone tumor, we're able to cure 50 to 60% of children. So it depends on the type of cancer, and that's what decides how curable it is.
Okay, I think so it's fair enough, but there is a last question by Priya. Does chemo affect the child's overall development?
I think I mentioned this earlier as well, that it can, while the child is getting chemotherapy, but once chemotherapy is done, then most of the children continue to develop normally. So during the phase of therapy, it can cause some, problems, but later on, they catch up.
I think so, Dr. Sadaf, as we discuss about particularly about mental health challenges, and we don't have particular setup in the developing countries about it. I We hope that in the future there will be something like that, and we are looking forward to you that you will be taking some initiative like that, so that parents and their siblings can get some guidelines, some help, because mental health challenge is the most problematic thing for,
Absolutely.
because there are parents who are also thinking suicidal. They have
Mm-hmm.
so many doubts and fears in their minds. They need someone to listen to them. And I think
Mm-hmm.
so counseling, social counseling is the most important thing that is the need of time. So thank you, Dr. Sadaf, for having you on the our platform. If you want to give the last message, the floor is open.
Mm. Well, we should end with this note on the mental health challenges, and I feel we need volunteers to
True.
come and help these parents out, just to hear them, and parents who already have kids who are cured with their cancers. they can create forums, which is what happens in the developed world, to support these families while they are going through this and sharing their positive experiences with them and giving them hope. So I really, would like to, through your platform, also, give this message that please volunteer your time to come and play music in the hospitals, or tell stories to the children, or to just tell parents that let's have a cup of tea together, stay just take a break from your child, and just come out and take a break. And in at least in Pakistan, we do have a joint families is set up in a lot of families still, so there's some support, some physical support. But again, every family setup is different. But yeah, parents need this kind of support. And again, thank you very
Yeah.
much, Dr. Munir, for having me and for allowing me to express, my sort of views regarding childhood cancer and giving me this opportunity.
On the behalf of Global Forum for Teacher Educators, once again, Dr. Sadaf, for having you on the board. And we hope that in the near future as well, if we will arrange such session, you will definitely come on our platform.
I would be happy to.
Thank
It
you
would be
so
my
much.
pleasure. Thank you.